the glands and filling the glands and getting more girth. Because men say to me, I want to be proportionate. I want the shaft and the glands to be perfectly proportional. Well, let's talk about the spectrum of proportionality, because you have some men with thin shafts, like a thin shaft, but a larger glands. That's on one end of the spectrum. On the other end of the spectrum, we have those with a small glands but a thicker girth, right on the shaft. So most are in the middle, okay? Now, as we fill the shaft and the glands, the shaft may gain a 3/4 of an inch to an inch per treatment in girth, but the glands may gain a 1/4 inch. So now you're shifting in this direction on the spectrum. Now, still normal, still statistically normal, but you're going to be shifting in this direction. Now, if you say, hey, I want exactly the same proportion, well, my recommendation to those patients is do one treatment, see how it looks, look at the proportion. If you feel it's shifting too much to the right, meaning a smaller glands, larger shaft, then you may say, you know what, one treatment's good enough for me. But if you say, you know what, the proportion's still not bad, so let's do a second treatment. I always recommend 2 treatments just to get an 1.5 inch, 2-inch gain. That's substantial. Okay, so they move more toward the spectrum on the right, where the glands are a little smaller than the shaft, but still within the normal realm of and so forth, statistically. So then they have to make a decision ultimately. When they start approaching 7 and 8 in girth, that's when you notice visually that disproportion and so forth. So I mean, yeah, that's really the reality of it. Some patients don't care.
Yeah, and
Some don't care at all.
it goes to that simple thing of beauty is in the eye of the beholder.
There you go.
So, when a guy's looking at his phallus, does he think that, his gland is too small, his shaft is too big, vice versa? You got to figure out where that patient's at and say, okay, what do you consider a good looking penis? So the thing is, because you want them to be satisfied. And that's part of the cosmetics of what we're doing, trying to meet them where they're at. We got to figure out, what do you want?
And you have to balance that cosmetic appearance with functionality.
Yeah.
Because if your spouse, for example, needs an 8 in girth, now what's more important, that 8 to stimulate her incredibly, because that's what's going to happen, or the look of, the glands are a little smaller. Now keep in mind this, we know that the glands is going to be smaller. So what we do, when we build our shaft, right, when we're building the shaft with girth, we're using the filler, we're going to build the base, right, pretty thick, and we're going to bring it up, bring it up, bring it up. As we approach the glands, we'll taper a little bit, right? We'll taper. So to the eye, it looks like the glands looks pretty decent, okay? Now, of course, I have patients that are, like this, 9 inches and 10 inches, if you could believe that. When you do this treatment long enough, you're going to see those people coming in your door.
I don't understand why they want to be that big, but if that's what you want, that's what you're going to get.
Yeah, exactly. You can. That's the thing. But when you go beyond 7.5, 8, then the glands is just not going to be proportionate. But for those who want to be that super functional guy, okay, if that's what you're looking for, that function of being very large, stimulating that vaginal cavity that can receive this size, okay, then you'll be fine, okay? But I've noticed that most men are not as concerned about the size of the glands. Even though, yes, ideally they want to proportion it. We have limitations. Now, I will say this. We have limitations today, okay, but not necessarily next year, because we're developing things, and we'll talk more about this, ways to expand that glands to make it pretty well proportioned, okay? That's upcoming, we'll be talking about that as we roll these things out and so forth and develop them. But we're excited about the future and a lot of things happening. Now, let's switch gears a little bit, and let's talk about lengthening procedures. What do you know about length and how you want to handle that?
Well, when we start talking about length, you can start talking about what can you do to actually make the penis longer. And that's always been a challenge. A lot of it comes back down to how understanding the anatomy of the penis and what's going on. What you see with the body is that when a man is looking down at his phallus, he may only see this much size, but you got to realize that a lot more goes back into the body where it attaches. So there's a lot more where you may be actually this long. Well, I'm exaggerating, but you may be that long, but this is all that comes out. That's all that's outside of the body. When you look down at your pelvis, you only got this much, but you got another length down at the bottom like that. So the thing is how can we take advantage of that so you can actually get your natural penis to come out further? And that's what we're looking at, and that's what we talk about when we start talking about how is it attached, what can we do to actually get you more length and to make it natural.
So, knowing the anatomy, we know how the penile shaft elements attach to the pubic bone. Okay, basically that's what happens. So the question is, how can we lengthen it? Well, let's first define two types of lengths. The flaccid length is when you just relax, non-erect, and this is what it is, right? You always hear the Seinfeld episode. I don't even watch Seinfeld. I mean, it's an old movie. It's an old series.
Yeah,
They
yeah.
talk about
That's
like,
a good
hey,
one.
I just got out of the pool and my penis is shriveled to nothing, and that's what she saw me. She saw me when I was shriveled. That's not my natural size, you know. That's kind of funny. But the point is that the flaccid or non-erect state can be embarrassing. Okay, it's like a woman. How do we explain this to women? It's like a woman with a D breast. All right, she gets cold and it goes to an A. She's not going to like that. Okay, it's very similar to that and how a woman would feel. So let's explain it to the counterpart there. Bottom line is, men do want a longer flaccid state. They want to look nice 24/7, right? They do the drop your pants test, okay, which I like when you said when you see me, you have to drop your pants. So do the drop your pants test. Drop your pants and say, hey, if people were around, would you be embarrassed, right? That's
Yeah.
the bottom line. So the flaccid length can be increased, okay, by certain methods. Then we have the erect length. That's different. So when you're erect, when the blood comes into the cavernosum chambers and you have an erection, is it adequate? Are you 5 inches, 7 inches, 9 inches, whatever it is? What do you want to be? To increase erect length is a little more challenging. Okay, we're going to talk about how we do that and possible future treatments to increase that. So, flaccid length. Dr. Fussell knows what I do here is we put a sleeve in. So what we do is make a little incision here by the glans and so forth, below the glans on the shaft. And we slide in this tubular, semi-tubular, it's really a C-shaped structure, and it pulls the glans, pulls the shaft out, and it kind of holds it in position, okay? And that's basically how we get flaccid length. Now, sometimes I've noticed that if we put in the sleeve, some patients see some erect length, okay? Now, exactly how that happens, I'm not sure, but maybe it stretches the penile shaft, which it can. There's some stretchability to the shaft, and it might go beyond the erect length, and that's a possibility. But I don't emphasize that. If you want flaccid length, we use the sleeve. Now, erect length, let's talk about that. That's more challenging. Suspensory ligament release has been around for ages. You know that, okay? Suspensory ligament is, let me just show you something here. Let's just show our audience here what this is. And I'm going to demonstrate just using this gauze.
Because I was like, what is he going to do with the gauze?
Yeah, right. Now, Dr. Fussell mentioned this already, but he said that, what did he say? That this is what you see. This is the penis that comes out of the body. All of this is in the body. It's attached to the pubic bone and so forth, and it's not visible. But this is what you see. Now, what we want to do in one technique of erect lengthening is try to take some of that penis off that symphysis or pubic bone and have it come out longer like that. Okay, that's called suspensory ligament cutting, right? It's a suspensory ligament release, so we'll just call it release. So if we can release the ligament, right, and we'll have a longer penis. Now, what's the objective there is maybe an inch. Okay, now here are some of the problems with that. In the past, if you do a suspensory ligament cut or release, the penis sometimes reattaches, right? It goes back to where it was. That's not desirable. But if we release it and put a spacer in here, a little block of implantable material, and that prevents that from happening. So the success rate is much higher, okay? And that's how you handle that part. Now, what are the drawbacks? You know, patients will say that, and not a lot. I mean, a lot of them appreciate the length, but if you notice, the angle of erection normally is here, okay? It kind of follows the bone, it's exactly. So the erect penis will come out here, and the flaccid will drop down. So, right, that's your normal. But now that we dropped it all the way down here, the angle will be a little lower. Is that functionally significant? Not really. Okay, it's just a different position of the penis. As long as you have your erect length increase, that usually is more important than the angle at which it projects. Okay, so that is one issue that a patient may notice, that there's an angulation change. Otherwise, in general, I mean, that's a favorable event if we can get the erect length increase to an inch or so. That's the idea. Now, there are other ways to do it. Now, you had mentioned something about stretching, like the flexibility, the elasticity of the penis.
Yeah, if you go back into the history of what they've tried to do in the past, you can see where guys have done things where they hung weights on their penis, or, you know, they've done things where once the suspensory ligament was released, you could wear a band on the leg and actually keep it on stretch that's trying to keep it from scarring back into the position that it was once
Yeah.
before. So there are a lot of different things that have evolved over time. And then too, you have to understand exactly what you're doing when you're releasing this ligament, because you don't want to cause the penis to become unstable. So there's a lot of different things that we take into consideration, of what we're doing when we're actually increasing your length.
It's interesting that you mentioned non-medical methods of increasing length, and men that have used weights, literally, attach something to the penis and drop I was going to say 50 pounds. That's a little too much for the regular guy.
Yeah.
So anyway, you hang weights for hours, sometimes hours a day. These guys
Send
do
your
it for
penis
hours
to
a day.
the gym.
Yeah. Now, if you notice, you say, well, how does that work? I mean, why does that work? Well, let's look at other ways, other things that people do to stretch skin. Like some people put these rings in their ears and they expand their earlobe, and they form a hole there. I don't know what they're doing, but it's just constant force causes the skin to stretch. It's like a woman having, a child, right? She's developing and so forth, and the belly stretches. Well, the skin stretches over time, right? So the belly can actually extend quite a bit, but when the delivery occurs, that skin comes back. But regarding stretching skin, the concept is pressure, constant pressure, long-term pressure. So if you're interested in erect length, possibly it probably helps with flaccid length too. If you're hanging weights, let's say you're doing an hour or two a day for a couple of years, patients have said they've gained an inch. And that's great, but not too many people have the patience for that. I don't think they want to be
We
sitting
don't
at 2
recommend
years.
it.
That's right, because of damage. That's another thing.
Exactly.
Yeah, because I knew you were going to say that. Because when you hang weights, you're stretching nerves and vessels and so forth. You got to be careful with that. You got to do it slowly and carefully. Penis pumps really don't do anything for length. It's a temporary fix. I'm switching gears here, but everyone heard about a penis pump. Right?
Yeah.
You use it in your field for help with erectile dysfunction.
Actually, we use pumps quite a bit. Say, like if a guy had his prostate removed, and things that we can do to continue to get blood flow down into that penis. When I talk about, because I'm a urologist, and I could jump deep into this conversation about erectile dysfunction, but just on the surface. Basically, there are three things that you need to get good erections. All right, you got to have good blood flow, you got to have good nerves, and you got to have desire. So whenever a guy sits in front of me and he starts talking about, his problems with erections, I got to say, okay, well, what's going on to affect your blood flow? Is it, your medicines for your heart, or you got blood pressure problems? Do you have diabetes problems? When we talk about the nerves, have you had radiation to your pelvis? Have you had your prostate removed? Has anything affected your nerves? And then finally, your desire. That's your testosterone level. So it could be a guy out here who he can get erections, but I just don't want none. Or I want it all the time, but it won't respond. So the thing is that, I always have to approach it from that standpoint when we start talking about erections. But the thing is, what you don't want to do is you don't want to damage your penis. When you start talking about, stretching and putting weights on it and things of that sort, that's not what we recommend. But when we talk about pumps, what happens with the pump, you're actually pulling blood flow into that tissue. And what you have to understand is that when you talk about the tissue itself, if you don't use it, you lose it. So what happens is that corpora cavernosum in there, it's like a sponge. If, unfortunately, I've had to be in a position where I've had to remove a penis, because the treatment for penile cancer is to remove the penis. So I've never enjoyed that surgery, where I have to take a guy's penis off. But the thing is that when you cut the penis, you realize that tissue in there actually looks like a sponge. It's spongy tissue. That's where spongiosum, all this other kind of stuff. And that tissue, what happens is it fills. So if you could imagine a sponge that you took and you've been using it and you put it under the sink. I haven't used that sponge in a long time. It's hard, because it's been sitting under the sink and all this other. And when you try to get water back into it, you got to sit there and squeeze it, trying to get it to actually take on fluid again. That's the same thing that's happening with your actual tissue. If you're not filling it up with blood, then that tissue is not used to responding. And that's what happens when we take stuff like Viagra or whatever. What it's doing is it's relaxing that vasculature so it can actually expand and you can fill it with blood, and that's an erection. Or you can take a pump and you can pull blood into it. So what you want to do is you want to keep that penis functioning. You want to keep blood flow going into that tissue. Otherwise, if you don't use it, you lose it.
That's a good point. So, men, the moral of the story is don't sit under the sink. Bottom line, just don't do it. Okay.
Yeah.
So that's good. I'm glad you broke it down that way because you have to have all those in play. You just have to and so forth. We can't underestimate the importance of testosterone either because we'll talk about that in a second. Let me go back to the first thing. We're talking about these weights. You have to be very careful, right? We could seriously damage the penis. A lot of guys do it. They're going to do it anyway. But just do it safely and have a doctor maybe supervise or, to just examine you to make sure everything's good and so forth. But testosterone is a key player here. I mean, if you were to cut your testicles off today, trust me, you ain't going to feel too good in a little while because you're not going to have that desire. Testosterone gives us that desire within our brain. It's a chemical thing. It's physical, but it goes into the emotional part of it too, and so forth. So you need that, and so forth. So you get your testosterone checked and get it to a decent level. I mean, do you provide testosterone therapy in your
Well, I've been
clinic?
doing that for years. I mean, the thing is, when a guy comes in to see me and they say, doc, just really don't have the energy at the end of the day. I'm on the couch. I really don't have that sex drive. My wife is complaining. All the signs
good.
are there. I'm not responding in the weight room. So, because testosterone is that male hormone. So first thing I'm going to do is I'm going to look at the hormonal axis. I'm going to look at, what's happening with the anterior pituitary gland, the LH to FSH. How is it stimulating the testicles to make, to stimulate the Sertoli and the Leydig cells, and testosterone production and all this other kind of stuff. Are they dealing with primary versus secondary testicular failure? Trying to figure out exactly where is the problem. Because you could have certain cancers that can also cause that too. So I have to do this full workup, in urology, and that's commonplace for a urologist to know that. Now, the thing is once we realize, hey, this is your problem, and it's primary testicular failure, meaning I'm stimulating them, but hey, the ornaments on the Christmas tree just ain't making testosterone. So now what I'm going to say is I'm going to give it to you. So I'm going to give you testosterone, and there's a lot of different ways to deliver that. I can do an injection, you can do nasal sprays, you can do patches, you can do pellets, all these different ways trying to get testosterone in the body. Don't be confused. You see these commercials where they say, oh, you can just take it. Testosterone, when it hits the stomach, is destroyed by acid. So medications that you talk about taking by mouth, they really don't work. Time it hits that stomach, the acid will destroy testosterone. So all these testosterone pills that you see over the counter is not true. You got to actually deliver it and get past primarily the gut. Now, so that's why shots work or patches work, or pellets. That's why those things actually work to get your testosterone level up. And then you got to think about testosterone replacement and what are the downsides. It can thicken the blood, increase your risk of heart attack or stroke, things of that sort. It can also stimulate your testosterone level, could feed prostate cancer. So we have to check all of that if you're going to do testosterone replacement. But can you do it safely? Yes, it can be done safely. And I've gotten patients that have been on testosterone replacement for years. But it's a management thing, So you have to actually manage it. If you see their PSA is going up, you got to stop the testosterone replacement and say, am I feeding something? Am I going to cause this guy to have prostate cancer much earlier in life? And I actually put kerosene on the fire. So testosterone replacement is not just a simple thing. But if you know what you're doing, you can do it for years safely.
A little caveat here. Okay, this is important. Women also need testosterone.
Yeah.
Okay, so if your ladies are not kind of up to the task, so to speak, my suggestion, okay, if they're not getting aroused or they don't have this, they're not in the mood to have intercourse, or they're not romantic, and something's going on, something's fishy. A lot of doctors now are treating women with testosterone, generally with a pellet. Now, a pellet is something that's inserted in the behind, and it's a pellet that is made of testosterone that dissolves slowly, so it causes testosterone in the bloodstream relatively in an even manner, and so forth. And I think it's efficient and effective. You get maybe 4 to 6 months out of it of therapy. So the point is, your ladies, okay, we always talk about men needing testosterone, which we do, okay, but women, even though they need a lot less, they still need it. And that stimulates kind of their engines, then they get motivated and so forth, and get more aroused and have that feeling of wanting intercourse and so forth. So I just wanted to mention that because that's kind of important.
Yes.
for the women and so forth.